all of which are natural and normal reactions to the changing and uncertain situation that everyone finds themselves in. Well, tonight, Dr. Frank Njenga takes some of your questions on how to mind your mind during this particular time. So thank you so much, Dr. for joining us on NTV Weekend Edition. So Kenyans have definitely asked a number of questions, and we're going to sample some of them. Here is one of the questions from a Kenyan.
Hi, my name is Angel, and I have a question. I'm feeling a little bit anxious just staying in the house. Should I be concerned about my mental health?
I think the reality is that we are all living in very abnormal times. And if you are feeling anxious, Anvil, that tells me that you're a normal person. Any person who has no sense of anxiety or apprehension about the times we find ourselves in is the one who is abnormal. So, a little bit of apprehension and anxiety at this time is what we would expect of all normal people in these very abnormal times.
All right, Dr. Indeed, that's a very important, of course, aspect that you've brought up about. But also, let's listen in to the other Kenyan also who's asked a question.
Hi, my name is Fatma Sufi. As we all know, self-isolation is very difficult. So how can I manage my mental well-being? Thank you.
I will repeat what I have said. We are going through exceedingly difficult times. We are being asked, quite correctly in my view, to do some exceedingly abnormal things. We are being told don't shake hands. We are being told don't go to church. We are being told don't go to funerals. We are being told all the things that we mental health experts advocate as the right things to do to promote mental health are the very things that we are being told, do not do this, do not do that. Now, this whole question of isolation, again, is abnormal. Human beings are animals that like to congregate together. The success of the human species, actually, is because human beings have been able to congregate and work together. Bottom line, therefore, is that isolation is the abnormal case. Isolation is a correct thing which we must all do, and a measure of anxiety and apprehension is to be expected. Now, how does one deal with isolation? Everybody has a different way of dealing with this abnormal situation. We are all agreed that during this period of isolation, a daily routine, one form or another, is important. But I think critically, and I repeat this, physical exercise associated with a regular regime is really what we are all looking for. But if you find it difficult, that is because being isolated is a very difficult thing for normal people.
Right, Dr. So we're going to also take some of the questions that were posed on our social media platforms as well. So this is the first question. Any suggestions on how you can manage your mental health when you're a frontline health worker? Because you cannot escape the pandemic and you still have to deal with it every day head on.
Okay, I mean, there are a lot of studies all over the world that indicate that frontline workers and medical workers in this case are actually the true frontline workers, are exposed to higher levels of stress, depression, and anxiety than other people. China, in fact, was the first country to report this COVID-19 thing, and they have already carried out some studies among doctors and nurses, and already it's been established that doctors and nurses, and particularly nurses and female ones at that, have above average levels of anxiety and depression. Now, that is the reality as it is. That is part of the problem and challenge of being in the front line. But let me say this because, again, it's very important. Medical workers, and I don't say this because I'm one of them, are the most important resource in a pandemic of this nature. And it behoves, first of all, the medical workers themselves, and secondly, the government that they work for, to make sure that this very rare and extremely expensive resource is well catered for. And this is not limited to the protective equipment that that is mandatory. It also includes ensuring work on shifts that compromise their health. Therefore, whatever else governments do, whatever else we as a society do, we must ensure that the frontline medical workers are well catered for, are well remunerated, and most importantly, we make sure that their mental health is well and truly looked after.
Right. Yes, thank you, Dr. Also, another question here that we've been able to pick from Kenyans is, can exercise help me keep calm? Can exercise help me keep calm?
There are two answers to that. There is a long answer and there is a short one.
Right.
The short and perhaps more accurate answer is yes, 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 and yes again. I cannot overemphasize the critical role played by exercise at all times, and much more so during times when there is a lot of anxiety, such as this one. Therefore, exercise. That said, I don't really mean that we should all get up and run to gymnasium, because after all, many of them are closed. I am talking about very simple and very practical exercise. And the simplest exercise that one can do is walk. And a brisk walk for 20 or 30 minutes every day is more than the exercise that one would require in any particular day. If you are able to do more exercise that strengthen your muscles, the upper muscles, the lower muscles, and other bits of exercise, that is an absolute incredibly good bonus. So I am not suggesting that everybody goes and lifts many kilos of weight. I am saying that sensible and practical physical exercise that can be done by most people on most days is really, really very helpful in terms of dealing with the stress and anxiety that we are all going through these very difficult times.
Right, Dr. So also very important question here that has a lot of interest, because regarding older people, and especially those with underlying health conditions, have been identified as most vulnerable to the COVID-19. And to be told that you're very vulnerable can be extremely frightening and can also be fear-inducing. So then how do we approach this when we talk about the elderly and those with the underlying conditions?
In the earlier stages of this COVID thing, the message was very clear and it was very loud that only the old and people with other diseases, diabetes and tuberculosis and AIDS and other conditions, were dying from this condition. I mean, I watched you just now, and you're giving us the statistics and numbers of people who are dying, even in, well, not so many, people who are being affected by this COVID-19 thing the world over. It includes young people. I would like to suggest this, that we have made a good story, we have made a good and perhaps accurate statement that the highest risks are among the older people, but I think we need to change that messaging a little bit and say that all human beings are at risk. I have seen a number of young men walk around open and bare-chested saying, "Sisi ni ndume, we are not going to be." Let me tell you, this COVID thing doesn't know ndume. It doesn't know vijana. It doesn't know young people. It just knows people. That said, I would like to inform people of my generation that this thing is also real, and really we must all take great and exceptional care to make sure that we minimize exposure to ourselves. But it's a myth to suggest that this thing is only coming to take away old people. It will take away young and old. More old than young, but all people are vulnerable.
All right, so it does not discriminate. And lastly, Dr. Njenga, how can I talk to my children about the crisis, and does it have an impact on their mental well-being?
Okay, two things. One, it really depends on the age of your children. Little children under the age of 3 or 4 will probably not be able to understand fully the message and messaging. But after the age of 5 or 6, children will actually understand it's flying around in the air. It's also going around on door handles. It's also going on dirty surfaces. And this thing called a virus is carrying a disease that makes you feel unwell. And it's a bit like how you feel unwell when you have a flu or a cold. You can't play with other children. You can't go to school. It's affecting children. It's affecting mummies. It's affecting daddies. What am I saying in a long sort of way? I am saying that messages and messages really have to be age appropriate and relevant. So depending on the age of your child, you must package the message in a manner and language that is appropriate to the age and language level of the child.
All right, thank you, Dr. Njenga. And in just 2 seconds, your advice to Kenyans at this particular point on how they can be able to protect their mental well-being, very quickly.
My message is extremely simple. Our government is doing an incredibly good job. I would suggest that if we don't do anything else as a people, let's just listen to our government. This time, my view, very humble view, is that the government has got it right. We must listen to all the messages and the messaging, and we will be safe. Keep safe, and good luck to all of us.
All right, thank you so much, Dr. Frank Njenga. They're, of course, a mental health consultant, and just giving us tips on how we can be able to move forward during this pandemic crisis. Well,